Let's play Jeopardy! Today I'd like to focus on hip surgery and some of the facts about hip surgery that you may not know. So this is Dr. Centeno from Regenix, and we're going to play Jeopardy! So let's get some sound effects going here.
And now, here is the host of Jeopardy!
Alec Trebek. So let's start our board here, and we'll fill up our board. As you can see, we have lots of different topics on the board, but we're going to focus on hip today. Off to the right there, you can see all the different research that I've done to support everything on the board. So let's get started. I'll take hip for 200. This minimally invasive hip surgery can cause metal toxicity in the blood and has twice the revision rate in gals. What is hip resurfacing surgery, also known as a Birmingham hip? That's correct. Regrettably, hip resurfacing requires a metal-on-metal prosthesis, and that means that the metal shavings can rub off and that metal ions can get in the blood. So that's not a good thing. And it also has twice the revision rate in women, and it's believed that it has such a high revision rate, meaning the need for another surgery, because women have smaller hip sockets. So let's refill the board here.
First round, the Jeopardy round.
So I will take hip for 400. In one recent study, only about half of the patients were satisfied with the results of this hip surgery. What is hip replacement surgery? That's right, folks. In one recent large study from a Canadian registry, only about half of the patients were satisfied with the results of their hip replacement. Now that's pretty staggering when you think that such a big surgery only leaves about half of the patients saying, gee, if I had that to do over, I'd do that again. So that's a concern. Let's refill the board here.
The answer there is
We got the daily double hip for 800. So hip for 800. More than 90% of all patients have at least one x-ray finding of this disease. What is hip impingement, or FAI, or CAM impingement? Sure enough, folks, in one large study, if you add together all the different metrics that are used to define hip impingement on a day-to-day basis by surgeons and or radiologists, about 90% of all the patients in the study had at least one finding of hip impingement. So this is a little bit of a concern. This has been a huge surgery this last few years. There's been a number of different studies about this. And one of my concerns as a clinician is that it seems like almost everyone's got hip impingement these days. Now, could everyone really have hip impingement? I doubt it. So I think likely what's happening right now is we're getting an overdiagnosis of hip impingement and a lot more people getting operated on for this problem than there should be. Let's go back and fill up our board again. So I will take hip for 1,000. This big hip surgery increases the risk of stroke by 400 to 500% and heart attack by a staggering 2,500%. What is hip replacement surgery? Again, that's right, folks. This is a very big surgery with very big side effects. A 2,500% increase in heart attack for a couple weeks after the procedure, and a 400 to 500% increase in stroke for a couple weeks after the procedure. So these are staggeringly big numbers. Just to give you some comparison of these numbers, if you were to take statin drugs or cholesterol drugs for 5 years, the risk of reducing a heart attack is 1%. Just 1% absolute reduction in risk in a heart attack for taking statin drugs for 5 years. But a hip replacement surgery can increase your risk by 2,500%. So again, big surgery, big complications. So in conclusion, the research really doesn't support that many common hip surgeries are all that effective, and many of them have pretty significant risks for the patient. So we always recommend to patients to try biologic alternatives first, like platelet-rich plasma, stem cells, etc., simply because we don't have great research that many of the things we can do surgically in the hip work all that well. So thanks for playing Jeopardy today. I really appreciate you listening, and I think we will close it out here with the final sound effect.
This is Jeopardy!
Thank you much.